Well, look, it's concerning. Texas has an outbreak underway. I don't think it's so far gone that they can't get control of this, but they do have a large outbreak underway. They're recording about 1,500 new cases a day, and the positivity rate's going up. That's what's most concerning. So they can't argue that they're getting more cases just because they're testing more. Their positivity rate's going up, which is an indication that they have a spreading infection in that state. Their census in hospitals is at an all-time high relative to where it's been over the last about 6 weeks, 2,000 cases now in their hospitals. And the positivity rate's around 8%. And so that's all concerning. If you look at Texas Medical Center alone in Houston, that really seems to be the epicenter of the outbreak right now. They're admitting close to 100 COVID patients a day. To put that in comparison, all of New York City is probably admitting fewer than 50 cases a day right now. And so that's a pretty large outbreak in Houston. Again, I think they have an opportunity to get this under control. The question is the city, is the state prepared to take some of the mitigation steps that can help them get this better under control?
Let's talk about what they would need to do right now. What would you advise Governor Abbott to do this evening?
Well, I don't think it was the timing of the reopening in Texas. I think it's the speed of the reopening. Texas reopened a lot of things very quickly. They didn't stage it as much as other states did. So they started to reopen recreational activities, indoor recreational activities like restaurants, bars, things like that, sooner than other states. And so you might want to take a look at some of those and maybe dial it back, close some of those establishments, slow down any continued reopenings. They're talking about refilling stadiums with sports fans, things like that. I think they're going to have to pump the brakes a little bit on their plans to reopen more aspects of that state to wait and see what happens with this and whether or not they can get control of this epidemic. I think that the benefits of the sort of seasonal impact of this probably are largely felt already. There's not going to be much more benefit in a state like Texas, a city like Houston, which is already hot and humid. And so they're already having a seasonal impact in terms of reducing cases because they're entering the summer. Now they're bumping up against just the fact that this is spreading.
And what happens if they don't heed your advice tonight? I mean, you are suggesting this evening that they shut down some of the businesses that have been reopened.
Well, look, that's the challenge here. It's very hard to go backwards. It's going to be very hard for any governor to go backwards after reopening aspects of this state. And I think that's why this is so challenging, because we're not likely to do a simultaneous national shutdown again, even if we have an epidemic. I think we're going to have to reach for other measures like widespread testing, universal masking, the case-based interventions, trying to isolate people who are sick. I don't think that we're going to be shutting down businesses on a wide scale again, but Houston needs to look at what they can do to target the places where this is spreading. They need to figure out where it's spreading. So if you look at South Korea, they figured out that they had an outbreak that was spreading in certain kinds of bars and ping pong halls, and they shut down the places where it was spreading. So if Houston's able to do good case-based interventions, good track and trace, and figure out the establishments where this is spreading, they can isolate it in those establishments and either implement additional measures, additional protections, distancing in those kinds of establishments, or close them for a period of time until they get past this outbreak. But you know, this has the potential to grow bigger if they don't get control of it soon. They're probably at a tipping point right now with the number of cases that they have.
Certainly concerning. Are there other Texases waiting to happen? And where else would you be concerned about tonight?
Yeah, there's about 15 states where the epidemic's expanding right now. You look at North Carolina, South Carolina. Arizona is probably the second most concerning. About 30% of their ICU beds are comprised of COVID patients. 20% of the general hospital beds are comprised of COVID patients. They're diagnosing about 1,500 cases a day in a state that's a lot smaller than Texas. And so that's a hot spot as well. Florida and Georgia, the hospitalizations have trended down in the last few days, but I expect that to tick up after you have sort of the weekend effect and we start to see cases get reported into the week. They look a little hot as well. They have an expanding epidemic as well. The R, if you will, the transmission rate is above 1. And so there's about 15 states in all, 12 to 15 states where they're still expanding in terms of the number of new cases, and the epidemic itself is still growing.
You know, Dr. Fauci gave a pretty grim assessment, I'd say, today of the virus at a virtual conference. He said we are still, quote, at the beginning, and he said he was amazed at how easily this disease has spread, how quickly it has spread around the globe. Dr. Gottlieb, you share his views?
Well, look, it's a highly contagious virus. This is much more contagious than the flu. The R, if you will, is between 2 and 3, meaning for every case you have, you're going to get 2 or 3 new cases. With the flu, it's like 1.1, 1.2, depending on which season you're in and how virulent the flu is. So this is a highly contagious virus. It hit us at a sort of inopportune time. We weren't in our summer yet. We were still coming out of the winter. So we didn't have a seasonal benefit of entering into the summer. We're not through this. I don't know that we're at the beginning of it. I think we're somewhere in the middle. We have one more round of this virus before we get to a vaccine. We're going to have to get through the fall and the winter. Hopefully we get through the summer. I think we will. We're going to have isolated outbreaks like Houston. Hopefully states are going to deal effectively with those. But we really need to get through the fall and the winter. And again, the challenge for us is we're not going to want to go backwards. It's going to be very hard to shut down the economy again. I don't think we do it. I think we're going to have to look for other kinds of measures. We're going to have to lean heavily on things like masking, testing, asking people to self-isolate when they have symptoms. Those are the kinds of interventions we're going to have to rely on. And I think we're just going to tolerate or have to tolerate a higher level of spread and hospitalizations. The healthcare system needs to be prepared for that.
All right, so we need to keep our eye on Texas and Arizona, among other places. New Jersey, by the way, today is going to allow outdoor gatherings of up to 100 people. Is that a good policy?
Well, look, if you look at the states, you go to rt.live, and that sort of tracks the epidemic state by state, and you look at the states in terms of where it's expanding, where it's contracting. The four best states are Hawaii, New York, New Jersey, and Connecticut. And so the tri-state area is actually in very good shape. Now, they paid a very heavy price for that in terms of the mitigation they implemented and the scope of the epidemic that they sustained. But right now, the tri-state area is in very good shape in terms of a contracting epidemic, a shrinking number of hospitalizations, new cases being turned over on a daily basis. And so this area can afford to take a little bit more aggressive measures in terms of the reopening relative to other parts of the country that never really got out of their epidemic. I mean, Georgia, Florida, Texas, they never really got their caseload very far down. They always had a sort of slow burn at a very steady level of infection, and now we're seeing it tick back up again.
You know, we're talking about reopening, obviously. This evening, we've seen New York City try and get back to business. It's in the very early stages, obviously. You said today on Twitter that temperature checks are not a reliable way to check for the disease. I thought that was interesting, that 70% of those in New York sick enough to be hospitalized, Dr. Gottlieb, and presenting symptoms didn't have fevers.
Right. A very good study in JAMA looked at people who were being triaged and admitted to the hospital. So they were sick enough to be hospitalized for COVID, and only about 30% of them had fevers on presentation to the emergency room. What you really need is a layered approach to try to spot this infection. So if you're a business, you can do temperature checks, but you really should couple it with a very exquisite health questionnaire, and that's a symptom check. So if you have a good symptom check with fever checks, that could get you to maybe 40% identification of cases. And then you have to have a way to reflex people to testing so that if you identify anything on a symptom check, you direct them to go and get tested, and you actually try to facilitate that. And so in ideal circumstances, something where you have an electronic tool, you ask everyone to log into it in the morning, they go through a symptom questionnaire. If they pass that, they come to work, they get their temperature checked. If they pass that, they work. If they fail any aspect of that, then they go and they get referred to testing. Or if they think they've been in contact with someone with the virus, that would be another indication for testing. Businesses need to think about setting up that kind of a layered approach. If they have that, they're going to catch more cases. It's not foolproof, but it's better than, doing nothing.